For those who are hopping in, thank you for joining us today. Um, if you have not attended one of these sessions before, welcome. And if you have, welcome back. My name is Jenna. I am on the TDS Health customer engagement team. And so if you have seen my face before or my name in your email inbox, it most likely was due to a training that we've done for some of your TDS Health content if you're a current subscriber, or I've onboarded with you a product that you've purchased through us. So if neither of those situations are something you've experienced, I'm probably new to you. So I support our team from training to kind of product deep dives with faculty administrators to make things that we have work best for you all. So today we'll be talking about one of our resources called Neural Consult. We'll be focusing on how that resource can be utilized in the GME space, residency and fellowship style programs. I'm joined by my friend and colleague David Davis on this call. He's going to support on this session with myself as well. David, do you want to give a quick introduction?
Sure. Thank you very much, Jenna. As she mentioned, my name is David Davis. My background is clinical nursing. I was at the bedside for a little over 20 years, predominantly in the emergency room space. And I've been in healthcare simulation and education for the last 6 years.
Thanks, David. So as I said, we are going to be covering one of our resources called Neural Consult. I'll share my screen here soon and get that up. We'll be able to walk through some of those pieces. This session is set for half an hour. So this is really meant to be an introduction to the resource, tackle a couple of the different areas to show you what is in there, the little bit of the why as to why that product was developed and how it can be utilized. But if you want to deep dive it a little bit more or set up additional sessions to really speak to how this resource can support your particular program or set of programs, we can absolutely do that. So you should see that the chat and Q&A sections within your Zoom are enabled. So please feel free as we go through to utilize those to ask questions or provide feedback as we move through. We're happy to move through that and look at those things. We'll take some breaks here and there to check that chat and that Q&A to make sure that we're checking all the boxes for all of you. So I will go ahead and get my screen up for everybody. If you'll give me just one moment. And then David, I'll have you maintain and monitor the chat and Q&A a little bit. And then can you confirm that you can see my screen? You're muted, David, but it looks like if I read your lips
Yeah.
correctly, okay, perfect. Um, so before we hop into the demonstration and all of those pieces, what is Neural Consult? I keep talking about that. We'll be going through a resource called Neural Consult today. And Neural Consult is a resource that's been added to the TDS Health portfolio that is really designed to be a learning system where you can utilize and optimize your own material as well as the material that is within Neural Consult. So essentially what we'll be looking at today is the Neural Consult platform, which allows you to upload your own content, utilize content and guidelines that they have in there as well, and then create different varieties of content with that material, both as a student, a resident, a fellow, or an educator, administrator, or practitioner. So there's a variety of different utilization tools in here. They do have an artificial intelligence component to this, being a search element that they have to search across the content that you have. But I do like to point out that AI utilization is very much a controlled sense. So it allows you to search across the material that you upload specifically. You can also add the material that you have plus guidelines and peer-reviewed articles. So it's really designed to be that closed loop, safe environment for you can use the content that you have in a more efficient and optimized way. Um, what you'll see on my screen right now is going to be the student interface. So this is really going to be the user interface that we're going to touch on. There is an administrator side to this that we will pop into in a little bit to talk about, but we'll be spending some time in here specifically. Now, I want to give the caveat that I am not a resident or a fellow. I am not on a medical track right now. My background is medical microbiome, so you'll see that I have some preferences in terms of the content that I upload and I mess around with in here in our demo site. But just to give that caveat, that's a little bit about my background. And this is going to be my user experience that I've designed. So you'll see that we've got a couple of different places in here, and we aren't going to jump into every single section. We're really going to pop into some areas to talk about how this can be really utilized in the environment of a residency or in fellowship program to where they're expected to do these things within their certain frameworks.
Can I
So
jump in just 1 second?
please do.
Yeah. I think, my job here today is to talk about the why. And I just want to talk, being somewhat familiar with that experience, being in the hospital for as many years as I was. I understand that GME educators and administrators, program directors experience and stress out from a high workload, excessive, administrative tasks. That doesn't even count, the stressors for your residents who have very limited time for studying and other research related work, given their schedules. So in practice, Neural Console addresses that. By aligning seamlessly both with your hospital and program curriculum, your clinical practice protocols, your standards of care, and any specialty requirements. And in practice, it really transforms your lectures, your articles, into that personalized learning journey that Jenna referred to. And so now you have AI driven medical research, flashcards, board style questions, even podcasts, and live OSCE-like simulations. I just want to give you a little background on our AI because AI throws people off sometimes. And that's part of the reason why they developed this platform is because it's become a bit of a wild west for learners. Numbers are extremely high of how many learners, both in general and med school, are using third-party AI platforms that aren't necessarily in alignment with your program. But the type of AI that's used here in Neural Console is referred to as Retrieval Augmented Generation, or RAG. I'm not an expert in AI. I certainly don't develop anything like that. But it's an AI framework that actually builds upon large language models, which are your Geminis, etc. But it actually drives accuracy by retrieving data that's really trusted from knowledge bases, like your documents or respected, reliable databases like PubMed, in order to ground generated responses and be able to, trust it and be reliable. Sorry about that, John.
No, thank you. That's great. That's kind of that leads us into the first section we're going to talk about is with that AI component, having that a controlled environment and having that confidence that the material that you're going to be pulling from is going to actually be relevant and specific to what you as an administrator or a faculty member want your residents and fellows to pull, as well as for themselves. They want to make sure they're operating within their scope and the expectations of their program. So you'll see that we're on my dashboard here in this top section up here. Again, we are on the demo site, so this is going to be my login. Well, you'll see that we have a search up here. And so to David's point, though, he was talking about having the ability to specialize where you retrieve information from is represented here. So you'll see that we have all sources, your uploads, guidelines, and journal articles, as well as the encyclopedia, which is a piece within Neural Consult. So we'll talk about that in a moment. And this is where you can make those selections as to where you want to pull information from when you do a search. So if you want to only pull information from the content that your program has uploaded to Neural Console, if you've got guidelines, if you've got standards of care, if you've got material that this is what I want pulled from, you can put that within the platform, and then the user can designate that that is where they're pulling the information from. Or as an administrator, you can do that as well. So This allows you to be selective in those pieces. And if you want to utilize peer-reviewed journal articles and the encyclopedia in here, you can make those selections as well. I'm going to do in a your uploaded files search. And so from in here, I have a couple searches that I was doing, and you can see that I obviously favor the microbiome world with things like flagella and C. diff presentation. But you can make searches in here of that content. And then when you make that search, it's going to generate you a result pulling from the material that you have deemed that it can pull from. So again, I decided to utilize just the content I've uploaded. I put a medical microbook in here. And so you'll see that you have that material generate with the uploaded file references as to where each of those source elements came from. Again, we do have the ability to do all sources. So if you want to search across a variety of different guidelines, journal articles, the encyclopedia. So if I wanted to do a different search, if I wanted to throw a diagnostic workup for C. diff infection. So if I wanted to do something and I want to see across all the material that is within the Neural Console platform, uploaded, reference specifically, there are peer review articles and the encyclopedia, I can do that as well. It'll generate me my search and it will show me on the side over here where within the uploaded files that are put into Neural Console from our own content, whether that's the, uploaded content from faculty, I have those pieces. And then if I scroll down, you'll see that we've got the different encyclopedia articles and then the peer-reviewed web sources that we have in here to generate this information. So really, it brings that work up there for you where you can pick and choose how you want to receive that information and where you want that information pulled from in your searches.
It's important to mention, I think, Jenna, that
Yes.
as you do that, everything is cited. Okay. You can go immediately to whatever source that came from, whether that be inside your program or if it was part of a PubMed article that was accessed through the encyclopedia.
Absolutely. So in addition to the search option, there also is what's considered the AI notebook. So this is kind of expanding on those searches that we've just been completing and creating, where you can actually build up more of a kind of personalized experience in this notebook setting where you're able to generate information from, again, your uploaded content, the content that's peer reviewed in the encyclopedia with the Neural Consult, and generate a notebook for yourself, essentially. Um, and David touched on this when he was giving some background a little bit earlier on in our presentation, that if I go to generate a summary here, I have some selections I can make from how I want to generate that summary. So again, I can decide to upload a file if I want to upload content specifically that I want to pull from. I can also pull from the file drive that's already within here. I can use a YouTube video and I can also upload additional notes. So I can put all of the material I want in here to generate me a summary that I would like. And so I can utilize the file drive that we have in here. And again, these are some of the shared materials we have for example purposes, but to kind of give you an idea of your experience in here, if we were to upload again, certain notes or certain competencies, certain pieces that you want that your users would pull from, this is where that would be able to show you. See that we've got shared content in here. I was looking at the acute myocardial infarction article, so I'll throw that in to just kind of show you this experience. And so if I want to generate me a note section, so a notebook entry from this, I add that in and then I get to make specifications about the kind of summary that I want. And this is what David touched on earlier about having the ability down here at the bottom to generate a podcast. But I also can decide what kind of summary style I want. Do I want it in bulletproof? Do I want it in bulletproof? Do I want it in bullet points, a paragraph? Do I want this to be a shorter, medium, or longer summary? Do I have additional notes of focus areas and things that I want to really highlight and lean into? I can make all of these specifications here when I generate this material. So if I'm someone who wants bullet points, and let's say that I want a short summary, and let's say I also want that podcast. And there I can also decide how long I want that podcast and if I want any customization elements as well. And then I can generate that summary with the information that I provided to give me that notebook entry that I can use for my own studying, review, or retrieval. Um, while that's generating, David, did you have anything you wanted to add or anything at this time?
Well, as that's generating, and you'll see how quickly it's done. And this is both for faculty, educators, and for your learners, residents. Things happen so quickly that this program, this platform, truly drives efficiency, efficacy, and standardization. So everybody's singing from the same hymnal, okay, within your program and your institution, but they're having to spend less time learning. And we'll talk about what some of those resources are created with your content to help affect that learning efficiency. Okay.
Awesome. Thanks, David. And you'll see here that we've generated, so we've got a podcast up here at the top that we've got a little 12-minute podcast that was generated from the acute myocardial infarction article. And then I've got this bullet point focused summary of the material that I wanted to have built out in my notebook. And so again, I am using kind of some of the canned content that we have in here to really show how this can be utilized. But to David's point, this is where you can really lean into that unique experience for your residents and fellows and for your administrators as a time save to really ensure that they're pulling from the information you're expecting them to review. And also that they can do that combination of different clinical guidelines that is presented within your program, and then maybe from the encyclopedia or standards of care that is more universal. So you can use all those pieces together to generate you things that your faculty, your students, your residents and fellows can pull from easily and quickly within the resource. I am going to hop over to the encyclopedia really quick because I keep referencing. This is going to be a pretty comprehensive encyclopedia with about 1,700 articles curated in different categories. You can make searches across the different categories in here, but just to show you what we have represented within here, this is where that myocardial infarction article was coming from that I referenced. But you can open up in here and you'll see that different subcategories open up as you build out the different categories. And then you can make selections on the different articles you would like to open up and take a look at. And again, you'll see that these all have their references in here, a table of contents, and you can move through and read through these different areas as well. Now, we've been living a lot within the learning section, which is over here on the left. I want to pop over to this practice section that we have as well. I didn't see any questions or anything coming through, so I think we're okay to move
No,
over. David, anything you have to add on this section before I hop over to practice?
no, at this point, I do want to talk a little bit more about that personalized journey as we dive a little further into this.
Absolutely. So let's hop over to the practice section that's over here on the left. So we looked at the search, we looked at the notebook, we looked at the encyclopedia. And this is where you can do some actual practice and application of the content that's in here that we're doing searches with, that we're looking through, and we're using for reference and retrieval. This is where you can utilize them in more of an active setting where you can take actual practice measures. And so the first section being that we have a board question hub. And again, before anyone looks at my scores of my results, I am not studying for my board. So please keep that in mind as you look at this. But you have the ability to generate different question sets built on the content that, again, you've uploaded or you decide to retrieve from in here. And so you have the ability, whether it's specific specialty measures, or if you're trying to focus your students on something in particular, or if they are seeing something in clinic that they want to assess themselves on and can upload material on that, they can generate questions for themselves to take and utilize in here based on that information. So you'll see that I have a couple of different areas in here of the different tests that I've done where you have some performance reviews. But just to show you what this would look like if I was to generate a question set, a set of questions in here. Again, I have the option to utilize the general topic areas, pull specifically from a file, or I have an input free text. If I want to throw in, this is what I want to pull from, this is specifically what I want to test myself on, I can do that. So you'll see that we've got a couple of different exam type representations in here. And that is because this platform can be utilized at a variety of different levels because people can upload their own content and specialize the experience. So I'm going to select generic board questions, but you can also do generic questions if you want to just test yourself on a particular topic versus an actual board style question. Um, from there, I can pull from different systems. Again, I'm doing by topic, but if you wanted to, you could use files to pull that information. And I can make those selections about what I wanted to test myself on. If I have certain topics within that subcategory, I can do. I'm kind of making quick selections just to show the experience. And then the number of questions I want to assess myself on. So I can make all these selections as I build out these questions as to what I would like to see represented in the question set that I'm generating.
Can I step in just for a second?
Please do.
Just in reference to the board style questions, one, we do have USMLE 3, as you could probably see on the screen there. Um, but more importantly, there was an independent blind study that was run to compare NeuroConsult's AI-generated board review questions to official NBME questions. And the results showed that AI-generated questions were actually rated significantly higher in clarity and educational value. And expert reviewers gave NeuroConsult questions better scores for question STEM quality as well as explanation quality.
Thanks, David. And then I did see a question come through about utilization of the platform to create a PowerPoint presentation. And now I don't believe that NeuroConsult has the ability right now to specifically generate a PowerPoint slide, but you can utilize the information to then create slides with and pull from that AI notebook, those searches, deciding the size of the search and how big of an explanation you want. You can utilize that content, but it doesn't right now generate an actual PowerPoint format for you.
But you can't export anything that you upload.
Correct.
Yeah.
So while we were giving our little spiel, we had our questions created. I did the endocrine system, specifically looking at Graves' disease and thyroid disorders. And so I had it generate me a 5-question board style question set where I can go through and assess myself on these questions. I will get key insights into the explanation for that question and the details about it. So I can move through each of these and assess myself on these questions, get that breakdown as to why something is right or wrong, and move through and take these. So just to show you what that experience looks like, you have the ability to go through and take these questions. Let's get through my quick little 5-question one so we can move on through. And again, I did a board style question. And so you also have the ability to do generic questions if you don't want to necessarily take something in more of a board style environment and more of a reference and recall of particular topics. And then you'll see here at the top that I've got that breakdown on that particular topic that I took, how I did on that question set that I have for review. In addition to the board style questions, you also have the flashcard hub, and this is where you can generate flashcards for reference and material that you want to take a look at. You can use that spaced repetition approach where you can suspend information and suspend flashcards depending on how much your knowledge is keeping up, how well you understand those pieces. I want to make sure I have time to jump into the clinical case hub, so I'm kind of quickly moving through these areas, but essentially the board and flashcard areas where you can take those search information pieces that you have from within that learn element and utilize them in a practical standpoint where you can quickly recall information to test yourself if you'd like.
As far as the flashcard is concerned, they used spaced repetition algorithms, which optimizes long-term retention. Studies have shown it to be very, very effective in that way. So again, we're leaning back into the learning efficiency, but this also saves significant amount of time, both for students and faculty, spending time creating flashcards or questions, etc., because the AI is so effective in doing so. And one other thing I wanted to mention is, given the personalization journey for each student, This platform actually tracks which questions, which cards you do with, and as we get into the simulation part of it, it will actually track what topics they struggle with and even how they interact with the content. And when it uses that data, it can adjust the actual study experience. So, for example, if they're studying, having problem with a particular area, those questions, those flashcards are going to show up more frequently. If they're doing well, then that spaced repetition will, back off, and it knows how often to pop it in so that learner will continue to retain that information.
Awesome. Thanks, David. And going into the simulation piece, I'm going to probably have David lean into a lot more of the discussion and explanation of this area with my background being more basic sciences heavy. So the last section within this practice area that we're going to take a look at before spending some time in the administrative portal for the last couple minutes of this call is the clinical case hub. So within here, you do have the ability to complete clinical cases that are within the Neural Consult platform. Again, we have some canned ones in here. So if we wanted to start a case, we could start a common case, and you'll see them down here that are broken out by specialty. You have particular information for each of them, and you can complete a full sim versus a quick sim within here. David, can you remind me of the difference between those?
The long and the short versions.
Yes, please.
Yeah, the long version is much more of a traditional OSCE experience where you will get a very brief explanation of the patient, the presenting complaint, etc. And it would be just like going into the room. And then you begin your interview and your assessment and begin to add notes and all your diagnostic differentiation. And you begin to put all of that in, and you're scored on that. You're scored on soft skills. You're scored on, appropriate tests run in response to those diagnostic tests and what you ultimately determine to be the appropriate diagnosis. And all of that information is available immediately to you in feedback. And that feedback's also available in the admin portal so your faculty can begin to see where gaps may exist.
Awesome. Thanks, David. So I opened up and we're getting near the end. We've only got about 4 minutes left, and I understand if people have a hard stop right at the half hour, please feel free to hop off. We will distribute the recording, and if we go over a couple of minutes, we'll make sure that those pieces are included within that recording as well. Um, So I opened up one of the cases. If I was to hit get started, I'm not going to do a full case right now, but I do have the ability to utilize either a talk or a chat feature to interact with my patient in this setting. You'll see that I've got a little timer working up here on the side. I've got my pre-chart review. I can make notes, I can add notes and utilize all those elements as I go through and do my assessment of this particular case. Now, this again is going to be a canned case that we have in here, but you do have the ability as an administrator to create your own custom cases and custom rubricing if you would like to really specialize the material and the case experience to your particular specialty or circumstances that you see represented within your particular program. I'm going to hop over to the administrative tab. David, did you have anything that you wanted me to add before I did that?
I just want to say that even though these aren't, actual physical OSCEs or even mannequin based, the accuracy in interface really creates an ability to standardize clinical practice through, repeatable, scalable simulations. And they improve critical thinking and clinical decision making. And it exposes oftentimes residents, you can use it to expose them to unfamiliar clinical situations to increase their confidence. And it can also be used for remediation.
Awesome. Thanks, David. So I did see a little note come in on the chat, and I we'll need to, unless David, you have this answer right off the top of your head, asking specifically about validation with the AI generating information and the hallucination rate. I don't know if that off the top of my head.
Yes, 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 we have, Jason. And I can provide you all that information. It's well documented.
Awesome. Thanks, David.
Mhm.
So quickly, I'm going to hop over to the administrative portal in here. And so For the last couple of minutes, I really wanted to just focus on those areas that we discussed where the administrator and the faculty experience can also be very much customized, where they can generate, again, custom cases, look at analytics, and then also upload content that they want to then push out to students for utilization. So first and foremost, this case hub, you have your gallery and your rubrics. The gallery is going to be where you see, again, those pre-generated cases that we have in here, but you also can create a case over here on the top right, where you have the option to create a case from scratch, or if you manually fill in the detailed form to build out that custom case, or you can create a file where you maybe write out particularly what you want to see represented in that case, and you can upload that file and it will generate a case for you. Um, in addition to creating your own cases, you also can generate your own rubrics. So if you have particular expectations for your different residence fellows, students to be experiencing and to be doing while they are completing these cases, you can create a rubric that aligns with those expectations and those standards of care that you have, that you want to see responded to and presented in the case responses.
Sure.
Um, And then the other element, again, we're jumping quickly in here, and just so you know, this is not a one-time only. If you want to deep dive this a bit more, we'd love that. This is more just to give you a quick rundown as to what the resource looks like and how it can be utilized. Within the analytics component, we do have a variety of different analytics areas you can look at, whether that's the general account analytics, if you want to look at particular analytics as it relates to flashcards, questions, case analytics. So you can look down and deep dive these different things about the different groups of users, how they're interacting with the information, how they're doing on particular areas. And you can run that data and look at that material to see across those different groups if you need to build remediation groups, if you need to focus on particular areas for student progression, you can run analytics to look at those different areas across the board. And the
One
last,
thing,
oh, go ahead,
go
David.
ahead. Well, I just wanted to mention, because of those of you who have ever participated in writing a scenario, because I was very involved in that in the past, you know how many hours it takes, literally. Uh, I don't care if you're creating one here from scratch or using uploaded content or copying, making a copy of an existing one and modifying it however you see necessary. It only takes a minute to 2 minutes, literally, once your data is loaded in there, and it's all through a no-code interface. You don't have to know anything about writing code. So I think that's very, very important.
Yes, the time saving element of that, I'm glad that I didn't have to write hours and hours of cases.
Yeah.
And then the last piece I want to just point out is this file drive. And so this is something we've been referencing on the student side and then also on the administrator side. This is that file drive of shared content within here. So if you were to upload your own content, this is a little bit as to what that would look like. And again, Neural Consult is at the event of purchasing this material and using this resource, they will work with your team to get all of that in there to make sure those pieces are done. So you are set up with the curriculum elements in place to utilize it to its max potential. So you'll see here that we've got different file folders and you can search across those and you can see what's been uploaded and the particular areas. So again, it's putting your information within the resource and then being able to close that loop of utilization to have your students specifically focus on the content that you're putting in there or content that's been vetted and approved to be able to utilize from a clinical standpoint.
We're a little bit over.
We are a little bit over. I tend to do that, unfortunately.
Well, it's such an awesome platform, but if I were to summarize things for everybody, this platform is really all about efficiency and time savings. I mean, accuracy is a big thing, and we've addressed that. But it's efficient and time savings both for students and faculty. Um, Routine tasks actually are freed up for higher value activities like teaching and mentoring or actual studying through our automated AI platform.
Thanks, David. Well, I don't see any other questions coming through on the chat. Thank you for the questions that have come through. We'll get some information. It looks like we have a couple things that we need to follow up on. We will get this recording out. So if you had team members that you would like to share this with, you're welcome to do that. And also, if you would like to set up additional time to talk or a session to focus on how this can be utilized for your program or group specifically, we are more than happy to help coordinate that with you. Just quickly to echo David's sentiment about the utilization and summarizing neural consult, the piece that I like to point out also is the fact that you are not restricted based on your specialty or your particular area. We see a lot of fellowships and particular really specific subspecialties underrepresented in resources in the market. And because this is so geared around the expectations that is set within your particular area, you can really maximize that utilization versus having to adjust to something else because you don't have something specifically built out for your group. So really, we are here to help work with you and maximize this for your programs and within your system. So again, thank you for taking the time to hop on. We'll get some follow-up materials out, and um, if you have any interest in our sessions, we do have them on our events page on our website for upcoming and previous ones if you ever want to look at what else is happening in the TDS Health world. But other than that, I don't have anything else. David, if you want to close us out.
Well, it's just been a pleasure. Thank everyone for joining us today. Thank you, Jenna, for guiding us. And keep in mind, if you want a deeper dive, 30 minutes is hardly enough time to really give this particular platform its just due. So we're happy to arrange that for you. And thank you very much for attending again.
Thanks, everybody. Have a great day. Bye.
Bye-bye.